Hi, good evening. My name is Paritosh Sharma. I am a consultant vascular surgeon at 108 Harley Street. And this evening we're going to be talking about varicose veins. Let me start by giving you a little bit of history about varicose veins. So the first known record that we have of varicose veins is this papyrus of Papyrus that was, next slide, which is a document from back in the 1500 BC, which is the first known record of varicose veins. The next thing that we've got on my slide is this tablet that was discovered at the base of the Acropolis back in 400 BC, where you can see that there is a depiction of a leg with a varicose vein on it. And then this was followed on by this very detailed diagram of the venous anatomy in the groin by Leonardo da Vinci, and this is in 1400 AD. So this is the history of varicose veins. And I'm just going to talk you through what varicose veins are. When we talk to people, there are a number of descriptions that you'll find, including spider veins, reticular veins, and varicose veins themselves. And these are just some pictures to actually give you some detail about what these veins actually are. So the picture that you can see on your screen at the moment is of spider veins. Go to the next one. And this is a picture of reticular veins, and I've got another picture of varicose veins proper. My next slide will give you a little bit of description. So on the first picture, if you remember, they're very small, tiny veins, spider veins, which are less than 1 millimeter in size. They're usually pink, red, bluish purple in color, and they tend to be impalpable. Similar to reticular veins, which are bluish structures, slightly larger than your spider veins, but again, they're impalpable. And the furthest on the spectrum is varicose veins themselves, which are palpable, large. As I'm sure you've all seen them. They're big, grape-like structures, which are quite easily palpable. Go to the next slide. This is a slide of the venous anatomy. As I'm sure you're all aware, there's two systems of veins in the leg, the deep veins and the superficial veins. The deep veins are responsible for things like DVTs, whereas it's the superficial venous system that is responsible for varicose veins. On this slide on the left, you can see the great saphenous vein, which is the superficial vein, and on the picture on the right, you can see the small saphenous vein. Apologies about the Americanisms in these terminologies. It should be the long saphenous and the short saphenous. Moving on to the next slide, a little bit about physiology of veins. So when people walk, the calf muscles actually pump the blood back up towards the heart. And you can see a little description on the diagram at the top, denoting normal veins on the left with an intact valve. As the patient walks, the calf pump will encourage blood to pump up towards the heart. When the calf pump stops, rather than the blood refluxing back, the valves, when they're competent, will hold the blood in place. And the image on the right shows you a varicose vein where the valves are not working properly, so you're getting a reflux of blood, and it tends to pool in the veins. And as a consequence, the veins become large and protrude, and they can become palpable. Between the superficial and the deep veins, you have communicating veins called perforating veins, and then numerous veins all along the course of the leg. The picture at the bottom shows you a description of the middle perforator being incompetent, and you're getting a reflux of blood from the deep to the superficial system, and hence a pooling in there. Moving on to the next slide. So what are the causes of varicose veins? Well, we don't know a lot in detail, but we can comment on some associations. So we know that they tend to run in families. It usually tends to come from the mum side of the family. We know that pregnancy can bring about worsening of the varicose veins, and that's as a consequence of the gravid uterus itself compressing and increasing the pressure in the veins in the lower leg. And as a consequence, the veins become large and become palpable and varicose. We know obesity can also bring about varicose veins. They tend to be commoner in women, and we see more varicose veins with increasing age. There's also some association with contraceptives and hormone replacement therapy. Moving on to the next slide. So the symptoms of varicose veins, commonly patients will come to me and tell me about heavy legs, aching, cramping sensation in the legs, and it's especially at the end of the working day. For professions which involve standing on your legs for a prolonged period, patients will come and tell me that they have significant symptoms at the end of the working day. So that's the sort of time period when patients seem to experience more pain. They can also get swelling of the legs, especially around the ankle regions. They can cause itching, and they can lead on to pigmentation as well. I've got some pictures to show you. So here you can see along the ankle area, this is traditionally the gaiter region of the body. You can see that dark pigmentation that's appeared, and that's a consequence of hemosiderin pigment actually leaching out of the blood into the tissues and causing that staining. Once you start to develop this staining, it's very difficult to reverse that, but the idea would be to try and stop things from progressing by treating the veins at this stage. Another picture on the left demonstrating lipodermatosclerosis, where you start to get inflammation of the subcutaneous tissues as a consequence of venous hypertension. And this is a condition called atrophy blanche, which is a consequence of cutaneous vasculitis. So you're getting an inflammatory process in the skin and in the blood vessels in the veins of the skin, and this appearance can also present. So we've got this classification called the SEEP classification, which is essentially a classification according to the clinical, etiological, anatomical, and pathophysiology of the varicose veins. Till about 2013, 2014, before NICE revised its guidance. In the NHS, we were allowed to treat patients with C4 or worse classification of varicose veins. But since then, things have changed, and now the first-line treatment for symptomatic varicose veins is endothermal therapy. And I will touch upon that in my treatment section. So this is just the picture of the NICE guidance that was revised back in 2013, recommending endothermal ablation as first-line treatment for patients. So how can we treat varicose veins? So endothermal ablation, which is the most commonly used therapy now, where we deliver heat to the lining of the veins, and as a consequence, veins we can treat varicose veins as a consequence of the heat that sort of allows the vein to sort of occlude and is excluded from circulation. We can also achieve this by chemical means, so injecting a sclerosant, traditional surgery, and compression therapy. Just a picture about what I do here at 108. We've got access to a special laser treatment modality. This is one of the newer generation laser fibers that we use. You can see the bottom left picture is essentially the kit that we use. I will identify the vein at around the knee level, and then I will cannulate into the vein and pass the laser catheter all the way up to the groin, where the saphenofemoral junction is. Position the fiber appropriately using ultrasound. Deliver tumescence, which is my next picture. So here you can see cannulation of the vein. This is the appearance on the ultrasound, where you can see the idea is to inject anesthetic around the vein so that the vein compresses onto the laser fiber, making the treatment more effective. And what we do is we continuously pull back the laser. We're delivering heat treatment to the lining of the vein, and as a consequence, the vein occludes. By chemical means, we can inject sclerosant. I prefer to use fibrovane, which is a sodium tetradecyl sulfate compound that I can inject straight into the veins themselves. Here you can see a picture of me injecting sclerosant into spider veins. And you can see as a consequence the vein disappears. The bottom left picture is for foam sclerotherapy. This is a method called Tessari technique, where I mix the sclerosant with some air to form foam. The advantage that this offers is that I can treat larger caliber veins as a consequence. So this is performed under ultrasound guidance. You can see the graphic, the bottom left graphic, demonstrating an ultrasound probe and an injection into the vein itself. We can always go back to traditional open surgery. Here you can see the old way of treating varicose veins, dissecting the saphenofemoral junction out and then stripping the vein. Phlebectomies, which are small incisions performed over the veins themselves, and they are employed to remove the veins. We can also treat wound ulcers, leg ulcers. So here you can see some pictures of people with varicose ulcers. This requires compression in the first instance to try and treat or heal the ulcer, followed by definitive treatment for the veins themselves, which could be surgery, foam sclerotherapy, or endodermal ablation. So compression, I'm sure you're all aware, we prescribe compression stockings and for varicose veins as long as patients have palpable pulses or an ankle brachial pressure index of more than 1. I will prescribe them class 2 compression stockings. We have a whole variety of compression stockings now available on the market, thigh length, knee length, and so on and so forth. I've got a picture for compression bandaging as well. Again, we do this at 108 Harley Street for treating venous ulcers. Apart from varicose veins, I also treat arterial disease, peripheral arterial disease, carotid disease, aneurysmal disease, hyperhidrosis. I offer Botox treatment for hyperhidrosis in the axilla and also offer venal access treatments. Thank you. If you have any questions, please feel free to type them in.
No. No questions.
Please feel free to email your questions through to me. If there's any questions at all, you will have links on your emails that have been sent out as an invite that you could reply to for any questions that come to mind.
Okay.
Thank you.
Bye-bye.